Hello again. I'm Joel Barthelemy. I ran into a group of nurses and nursing students the other day at a yogurt store. We got to talking and I asked them if they knew what telemedicine was, and they admitted they didn't. I then took a few minutes to explain how connected health works and what we do here at GlobalMed. And once they understood, they thought it was a great idea for patients, for providers, for the whole healthcare system. Mainly because it provides access to healthcare, it's convenient, and it helps to hold down costs. Most people familiar with it would agree. A recent survey found that 76% of those questioned would choose telehealth or telemedicine over human contact with their care provider. So then, why don't more doctors use it? Primarily, it's an issue involving control of payments. Let's use the banking industry as an example. Just about everyone does some form of electronic banking, right? A lot of us use our smartphones because it's convenient and saves driving to the bank to deposit a check, make a withdrawal, or pay bills online. What if the banking industry arbitrarily decided that only certain people could do electronic banking and it made the decision based on where you live? The rest of us would have to make at least a couple of trips a month to a bank to handle our transactions. How well do you think that would work, knowing how convenient it is the other way? Exactly. The Centers for Medicare and Medicaid control the money paid to doctors who see Medicare patients. Doctors are small businessmen. They can't afford to work for free. Back in 2000 and 2001, when reimbursements for telemedicine visits were being discussed, there was fear that doctors would overuse the technology and drive up Medicare costs. So federal policymakers convinced Congress that telemedicine reimbursement should be limited to those doctors seeing patients who live in rural and medically underserved areas. Even with those limits, the Congressional Budget Office projected that telemedicine reimbursements would cost taxpayers $150 million in the first 5 years. But here's the good part. They were way off. Not $5 million or $50 million, not even $100 million. The Center for Telehealth and eHealth Law says the total bill for Medicare telemedicine visits from 2001 to 2012, a period of 11 years, mind you, was only about $20 million. Not even close to the projected $150 million over 5 years. Can you think of another program for which the government overestimated the cost? Not by a little, but more than 87%. Simply put, doctors have had no financial incentive to add telemedicine systems to see patients who live in urban areas. Thankfully, with the concerns about healthcare costs and the increasing shortage of physicians, there is growing momentum to lift these arbitrary restrictions on telemedicine. If you have comments regarding this blog or other blogs that I have online, please email me. You'll find my email on this webpage, but for convenience, it's joelsblog@globalmed.com. I'm Joel Barthelemy.